Is Coke Zero bad for your liver? It's a question we hear a lot, and especially as fatty liver disease becomes more and more common in the UK. Around 1 in 3 UK adults now has some degree of fatty liver disease, so people are rightly paying close attention to what they're eating and drinking. Coke Zero has become a popular swap for sugary fizzy drinks, but does that actually make it a safer choice for your liver? Let's look at what the current evidence actually says. First, a quick bit of background. Fatty liver disease, medically known as hepatic steatosis, is when excess fat builds up in the liver cells. The most common form is non-alcoholic fatty liver disease, or NAFLD, which is increasingly being referred to by a newer name. Metabolic dysfunction-associated steatotic liver disease, or MASLD. It's closely linked to obesity, type 2 diabetes, high blood pressure, and poor metabolic health generally. In its early stages, it often causes no symptoms at all, which is part of what makes it so easy to miss. Now, when it comes to sugary drinks, the evidence is pretty clear. Sugar-sweetened beverages are a well-established risk factor for NAFLD. The free sugars in those drinks, particularly fructose, can drive fat accumulation in the liver. That's one reason so many people have switched to zero sugar alternatives. But here's where it gets more nuanced. Coke Zero doesn't contain those free sugars. Instead, it uses artificial sweeteners, specifically aspartame and acesulfame potassium. And because it doesn't contain the sugars known to promote liver fat buildup, it doesn't carry that same direct risk. So does that mean it's completely fine? Based on current evidence, no human clinical trials have shown that artificial sweeteners at typical consumption levels cause liver damage or fatty liver disease. UK and European food safety authorities consider approved artificial sweeteners safe within their acceptable daily intake levels. It's also worth knowing that the WHO in 2023 advised against using non-sugar sweeteners as a long-term strategy for weight management. So while Coke Zero may not harm your liver directly, it's not a health drink either. There are some observational studies that have found associations between diet drinks and certain metabolic problems, but observational studies can't prove causation. People who are already unwell may be more likely to choose diet drinks in the first place, which makes it very difficult to draw firm conclusions from that kind of data alone. The overall picture is this. Coke Zero does not appear to directly cause or worsen fatty liver disease at normal consumption levels. But your overall diet and lifestyle matter far more than any single drink choice. A diet lower in free sugars and ultra-processed foods, combined with regular physical activity and a healthy weight, remains the most evidence-based approach to reducing your risk of NAFLD. And when it comes to everyday hydration, water is still your best option. There's one important safety note worth highlighting. If you have a condition called phenylketonuria, or PKU, you must avoid aspartame, which means Coke Zero is not suitable for you. If you're unsure whether this applies to you, please speak to your doctor. And more broadly, if you're concerned about your liver health, particularly if you have type 2 diabetes, obesity, or metabolic syndrome, it's worth having a conversation with your GP. They can assess your individual risk, arrange appropriate tests if needed, and give you guidance tailored to your situation. If you notice symptoms like persistent fatigue or discomfort in the upper right side of your abdomen, do get in touch with your GP rather than waiting. So to recap, current evidence does not show that Coke Zero causes fatty liver disease at normal consumption levels. The artificial sweeteners it contains are not the same as the free sugars known to drive liver fat accumulation, but overall dietary patterns and lifestyle choices are what matter most for your liver health. This video is for general information only. Always speak to a healthcare professional for advice that's right for you. Have questions about how your diet affects your liver health? Drop them in the comments below. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.